Hello, I'm Otto Chan. I'm a consultant radiologist with a specialist interest in musculoskeletal intervention. That means I tend to see patients, do a diagnostic ultrasound. I also interpret MRI and CTs. And after discussion with the clinical team and after discussion with my patients, I tend to do intervention procedures. That means, on the whole, that we try and do minimal invasive injections and try and avoid surgery. The patients that we see range from elderly patients with osteoarthritis all the way through to the weekend warrior, and obviously we look after a lot of elite athletes. I'm very lucky. I work with a fantastic group of clinical team who are world-class, and we have really state-of-the-art equipment in this hospital. Between us, we've pioneered most of the procedures that I do, so we do treat things in a very different way to most people. The procedures that we do tend to be involved really just a very minor injection, and most of the procedures are relatively pain-free. But we like to think that we provide really state-of-the-art treatment to all our patients. Well, we see patients in the elderly group mainly with osteoarthritis. Usually that's wear and tear of the knee joints or other joints like the ankle. And that group of patients, what we do is we do an injection into the joint. And at the time when we do the injection, we also provide them with aftercare, which means that we give them a sheet with instructions. For example, in a patient who has got a knee problem, we usually advise them to lose at least 10% weight. We then give them an exercise program, and I'm very lucky. I have a physiotherapist on site, and I've got two of the best physiotherapists in the UK advising my patients on how to follow up their exercise program after the injection. In patients who are referred to us from the Premiership or from elite sport like ballet, so I'm very lucky. I've looked after the Royal Ballet for 25 years and the English National Ballet for 20 years. So we get patients usually who come in with soft tissue injuries like tendons, and we're very much a sort of a world centre for Achilles and patella and small tendon problems. And so in that group of patients, we do little injections, whereas previously people would have operated on them. So the patients can go back to activity usually within 3 to 10 days, instead of having to take 3 to 6 months off recovering from surgery. We are very much there to try and stop patients having unnecessary surgery. Clearly, there are many patients who do need surgery, and that group of patients we would immediately refer back to the clinical team saying, you know, I think this patient should have surgery. But the vast majority of soft tissue injuries and a vast number of the joint problems that we get, we try and avoid surgery because we think that the patients benefit from going back to activity sooner, and also there's obviously much shorter rehab, and it's a lot less painful, and it's a lot cheaper as well. I would advise all patients to basically go and see their GP or their specialists first, and once they've actually got a problem, then they come back to us, and we usually what we do is, in my clinic, we do in effect a one-stop clinic. So the patient arrives, we see them, we do an ultrasound, we proceed to MRI or CT at the time when they come. We then do advise them on what treatment we think should be performed, and we actually do it on the same day. And then we give them physiotherapy for follow-up on that same day as well. So we are, I think, one of the very few hospitals in the country that provides a one-stop service, a truly one-stop service, with a very high level of expertise.